Greetings. Today I'm joined with a special guest, Dr. Keith Martin. And Dr. Martin is our Chief Medical Officer. He's also one of the lead physicians on our COVID-19 response team, led by a small group of physicians. Dr. Martin still practices obstetrics and gynecology and has been a long-term community member, so he's very vested in the success of our organization as well as the well-being and the health of all of the individuals throughout our community. So today, Dr. Martin is going to help address some of the questions that may be on your mind surrounding COVID-19.
Well, I think they've been adapting quite well, which is the key to this whole environment right now. As it has been described, it's an unprecedented time, and the providers understand that they have to fill in the gap where the gap is needed. And from a standpoint of specifics, we have some of our nurse practitioners working the tent for screening on a regular basis instead of being in the office. We have a plan in place for our family doctors, who are our utility players, to fill in the gaps at both the hospital and in different offices as the need arises. Those procedures have changed in two ways. In the pre-hospital side, or on the pre-hospital side, which we're talking the office, we have to obviously be able to get folks in and out in a very safe manner. And that volume is still high. Obviously, we have to still continue to take care of pregnant women, and testing, as the pregnancy requires, still needs to go on. We cannot do that remotely. On the hospital side, things are divided in our unit based on infectious disease protocols. Very similar to the other aspects of the hospital, we want to create a safe environment in how they enter the hospital, who's allowed to be with them while they are here, and then also as they exit the hospital. We have two people to take care of as they leave, and we have to be very careful in that process. But we've done a great job with making that happen. Now, the restrictions on visitors are very similar to other hospitals. We will only allow one significant other the entire time that a woman is here to deliver. But we want to create an environment where we are not missing the defining moment in their life, and I think we've done a good job of that. Yes, and we will continue to maintain that. The hotspots in the country have had some different rules, and I think that's created some anxiety in some of our patients, and as people hear different media reports, they're wondering, what are we doing locally? Well, locally, we are going to maintain that the significant other remains with the patient, both in delivery and postpartum. It is something that we feel very strongly about. The only exception is if we have a COVID-19 positive mom. And in those situations, which I won't go into detail here, we have to handle that a little bit differently. But outside of that situation, which will be a unique situation based on our low numbers so far, we will allow the significant other to remain as part of that process. Well, the CDC changed their position on this based on data that was not known early in the process. This whole process has changed at such a rapid pace because of the situation. And it's been confusing to people because media reports will conflict with each other, and they don't know really what to believe or how to interpret the data. We as healthcare providers have struggled with some of the conflicting data ourselves. But what we're trying to do is make the best decisions based on our current situation. And in our local health system, we have followed the CDC's recommendations and are encouraging a cloth mask in public when you are going out to crowded spaces where social distancing isn't possible. It's not necessarily to protect yourself, and that's where it gets a little bit confusing. The data that changed the CDC's perspective was simply the finding that people are shedding the virus before they have symptoms of the infection. And that was not known early on in this process. Different than other upper respiratory infections, the virus can be shed to other people quite easily before there's a cough, before there's a fever, before there is sniffles or a sore throat. And that is really different. So for us, the early part was the recommendations were to try and protect the usage of PPE, the personal protective equipment, for our healthcare workers and first-line responders. We really were trying to restrict that in order to make sure that our local people had enough in time of a surge. Now, the recommendation to wear a cloth mask is simply a public health measure, so the person wearing the mask does not have the potential to spread it to someone else. It really doesn't afford a lot of personal protection, but if everyone follows this, then we can help protect each other, and our most vulnerable population is relying on that. Now that's a question that most folks have in their minds, especially with the latest recommendations from the CDC about cloth masks. Now, sources are limited, but the good news is there is plenty of information for folks to make their own masks. Now you can go to Amazon and you can find some sites and some different places where masks are available. The issue is delivery and timeliness. So we do have a lot of sources available as far as instructions to make your own mask, even if you don't have the ability to sew or have a sewing machine. The CDC actually has a video, and Dr. Jerome Adams, our Surgeon General, actually does a very nice job of showing a how-to or a do-it-yourself method. But you can use a t-shirt, you can use cloth material. The actual material that's turning out to be the best is something that a lot of folks have and don't realize, but it's the reusable grocery bags. And that is a polypropylene material that breathes very easily, but also affords pretty good protection. So you can find that information online. You can go to our website at FHN for some instructions on how to make your own mask. And if you really are resourceful and you look at church groups and local folks who are really chipping in to help, I'm sure you can find a source available. Well, on a medical level, I'm going to answer that similarly to what you may see in the media, in that we are encouraging folks to really maintain the course with social distancing. The main transmission is from respiratory droplets. It is actually not from contact itself on surfaces. And so if we can continue to stay the course, these strategies are working. It's why we have flattened the curve. Now, on a personal level, there's been a lot of anxiety around this whole thing, and what Mr. Gridley and I have observed is an incredible amount of teamwork in this community, and I can't thank all of you more than I can possibly say. It is a time where we've asked parents to be at home, not only to operate their normal jobs, but become teachers as well. I want to just try and encourage you to keep the spirit. We will get through this together, and if the team stays with it, we'll get through this in a positive way and minimize any effects to our community. Thank you.
We've had quite a bit of activity at FHN, as you might imagine, this week. One of the things that were a bigger change for us is we redistributed how we place patients throughout the hospital. And what our goal is to try and create areas that have an isolation unit to them and other areas that are completely free of any kind of isolation patient. This is one of the ways that we're looking to maintain our day-to-day care for individuals that are not impacted by any respiratory concerns or by COVID-19. And at the same time, when we are seeing more COVID-19 positive patients, that we have a place where we can keep them in units together, which makes it a little bit more efficient to care for. And also it makes it a lot easier once we move out of this COVID-19 to restore our normal day-to-day operations and allow for a little bit different focus of the cleaning crews as well. Again, things that we're moving around to make sure that we're keeping our organization as safe as possible. One of the other things that's changed is we've now brought our COVID aid tent, which is located in our parking lot, up into full operations. And so we've trained staff, we've run through a number of drills, and we're actually starting to see patients that are coming in for basic screenings and very basic level type of treatments. So that's a big development for us. Again, we're hoping not to see a high utilization, but if we do so, we are prepared. We are continuing to look at our inventories, our supplies, and our stocks. We're also working with our labor force to make sure that they're well and healthy so we're able to meet any potential demand. One of the other developments that we had this week was our monthly Board of Directors meeting, at which time our Board of Directors were incredibly supportive and had lots of great compliments about our team of physicians, caregivers, and all of our staff across the organization, as well as recognizing many people throughout the community who have volunteered to help in some way or another. We've continued to receive some small quantities of personal protective equipment. If you've been watching the news, one of the adverse impacts that we're experiencing right now is the national strategic stockpile is basically depleted. So we're not expecting any more federal type of assistance to be coming into our organization. We've been trying to source personal protective equipment through different channels. We have identified one channel for the N95 mask that you may be hearing so much about. And that N95 mask is really important to provide a protective barrier for our healthcare workers. However, they're in limited quantity. Normally, an N95 mask would cost us less than 70 cents, so not a very high dollar piece of equipment where we start talking about protecting our staff members. Currently, the prices are over $6.50 for a mask. So we're seeing this bit of price gouging making it difficult for us to buy in large quantities, but at the same time, we're committed to buying whatever we can get our hands on in order to protect the people that are caring for our families. The question about whether we have enough personal protective equipment really depends on the severity of the patient. For example, if we have a patient that's in an intensive care unit that's on isolation precautions, there's an entire team caring for that patient. It's not only the physicians and the nurse that day, but also respiratory therapists, pharmacy techs, environmental services people, in and out throughout the day trying to care for that patient. It could add up pretty quickly. It would not be unusual for that person to see a dozen or so more caregivers providing that care. So when you start thinking about how much personal protective equipment it takes just to care for that one patient, it will go pretty quickly. For other patients that are not as severe and are in isolation, it's a lesser concern as far as the quantity of people that are seeing that patient, but still those patients need personal protective equipment as well, and so we could easily go through a couple hundred pieces in a day, and it doesn't take long when you have a couple hundred pieces per patient over a week or longer before you would deplete that inventory. So it really depends on the severity of the patient and then, of course, how many of those patients that we have. FHN is prepared for a surge, and we're uncertain when that will occur, if it occurs. We're all hoping that we can avoid that. However, if we do see a surge in patients, we need to be prepared to be able to manage and care for those patients the best way that we possibly can. So we've been going through different planning stages. We've been looking at all areas of our organization. We've been inventorying the number of beds and litters and stretchers that we have available, as well as assessing our workforce and their preparedness. So if we do see a surge, we feel pretty well prepared, but again, it's all about the numbers, and we could easily become overrun if we see a significant level of patients from outside of our community that are actually coming into our organization, which is a real concern as we look at some of the major metropolitan areas. If they're unable to accommodate the number of patients that they have, that usually has a ripple effect, which means that those patients are moved out to different areas wherever there is an available bed. And certainly we would be willing to step up and help in whatever way possible. Advice I would give family members and individuals throughout Northwest Illinois are the same that I give to my own family. I know it can be incredibly frustrating, and there's a temptation to want to get out and be together, especially this time of the year. And the best thing that we can do is not to do that. It's been difficult for my two boys not to be able to go out and attend their scouting activities or their sports, or even have their friends over to the house. But it's important that we all do our part in keeping safe, knowing if we deny some of those comforts today, that later on this year we're all going to be in a much better place to enjoy those kind of activities. So it's keeping up with the advice of making sure we're washing our hands, and also thinking about social distancing does not mean social isolation. We can still connect with each other in many ways, whether that's picking up the phone and talking to a long-lost friend or a distant family member, utilizing technology to FaceTime or interact or Skype or whatever technology that is available to you to make sure you can see that person, have a conversation. One of the things that I think has been really encouraging is neighbors walking across the street, and more friendly waves seem to be going on day by day. We're seeing people increasing their activity outside while also being cognizant of that social distancing. So finding out ways to really enjoy the simple things in life, learning online cooking, ordering a new book. Again, I know it's frustrating for many of us not to be able to do the things that we're tempted to do, but it's really important, especially during this time, if we're going to bend that curve, is to double down on our isolation efforts and make sure that we get this pandemic under control. Our community response has been overwhelming. There are so many individuals, businesses, community organizations that have called asking, how can we help support our healthcare workers? How can we help support our first responders? We've had different businesses donating meals to our emergency department and other areas of the hospital. We've had a number of folks just providing deliveries of snacks or treats for the healthcare workers. Other people talking about what kind of masks do you need, how many do you need, and being able to supply those. Again, looking at any way they could possibly help. Local businesses stepping up and saying, here's some equipment that we have available, could you utilize some of this? So our community outpouring has been overwhelming, and we're ever so grateful for so many of them that are stepping up to really help take care of our healthcare professionals and working together in collaboration. It's been a wonderful thing to be a part of.